Combine a background in healthcare, hospitality, and real estate, and what do you have? Natasha Perez, who saw a need and filled it. She single-handedly launched Trine Healthcare to bring improved public health services and wellness programs to affordable housing communities. Working with physicians and directly with healthcare providers and housing residents, she saw the need to bridge the healthcare gap for this deserving target population. Learn more about Trine Healthcare and the rollercoaster life of a dedicated entrepreneur.
Joyce Cohen and I have been hosting my Pause for Purpose sessions now almost 2 years. And in the process, we have discovered there are 6 elements of purpose. And one of the elements is starting your own business, your own nonprofit, and becoming an entrepreneur. So today we have Natasha Perez, who is the founder and CEO of Trine Healthcare. Talk about somebody who is passionate and committed to being able to help those who are underserved, to be able to make them well and to provide them necessary healthcare, connect them to the right sources. Natasha Perez is driven by her purpose. In fact, has just pivoted, moving her business from Rhode Island to Austin, Texas. She wants to help improve public health care by providing wellness programs in affordable housing communities. Her sponsor in Providence did not renew its support. Hence, Natasha moved to Austin, Texas, where she is in search of a new sponsor to provide this valuable intervention for an underserved population. She works with physicians and affordable housing residents living in underserved communities. Natasha saw a need to bridge the healthcare inequity gap for a deserving target population. And thus she founded Trine Healthcare. And with that, I'm going to introduce and ask Natasha to begin her presentation and tell us a little bit more of herself. And Joyce will facilitate the interview today, asking Natasha questions.
Hi, everyone. Thanks so much for tuning in and listening. My name is Natasha Perez, founder and CEO of Trine Healthcare. And yes, our mission is to provide wellness services and affordable housing, thereby improving the public health for all. The reason I started my business and the reason I'm so passionate about this is when I was working in a doctor's office for seniors on Medicare, I noticed that there was a large need and a large gaps that the physicians were encountering. So even though the physicians were providing excellent care, sometimes it was hard to get a hold of their patients. People weren't completing their annual assessments. People were not following through with their appointments. They weren't getting the testing done that they needed to. And oftentimes they simply did not understand their chronic conditions, and the problems kind of snowball and fester from there. And so I thought, what a great opportunity. A lot of our clients did live in affordable housing buildings. So I worked with affordable housing owners to implement these on-site wellness programs for the residents in affordable housing buildings. And we've had so much success. So I'll start out with a little video with one of our residents. She talks about what she likes about the program and how it helps her. And then we'll open it up for questions. Isis, what made you want to join the program?
I've always been wanting to lose weight. Like, I want to be able to be healthy, a healthy older person.
It's not about living longer or getting older, but it's really about how we feel while we're here.
We focus on a lot of small details that make big impacts.
Yeah.
So talking about it, doing something about it, it helps us.
Yeah.
Once you get your body in motion, you start feeling so much better. And once you feel better, you look better.
Absolutely. I want people to come in and say, oh my gosh, look, you lost 5 pounds today. Look, your A1C has dropped 3 points. Your diabetes is almost at a manageable point. I mean, that for me, that's a win for me. And I hope it's a win for the residents here as well.
I love this program. I love it.
And it's free.
And my favorite one is the exercises.
One of your neighbors has arthritis pretty bad, and now he's able to walk without his walking device, and he's lifting up chairs and opening doors for people. So this program is not just for seniors, and it's not just for some people in the building. It's for everybody. And we want everyone to be included. Wonderful.
Yeah, I'm gonna talk to more people about it in the community, because a lot of times they feel like it's somebody being nosy in their business, you know?
Yes.
And they don't want to get up early, or they don't. But once they get into that motion and they do the exercise and they start feeling better, and then they can realize that they can eat less and still have the main impact as a full meal, but healthier, then they'll start realizing that, health is serious.
And when I check everyone's blood pressure afterwards, it's always really, really good. That makes me excited. Your blood pressure has dropped significantly, which is amazing. Good
Praise
job.
the Lord.
Love it, love it.
Hallelujah.
Well, thank you so much, Isis. Thanks for joining us and giving us your testimonial. We really appreciate
always.
it. And we will see you at Exercise on Wednesday.
Thank you, Tasha.
Thank you.
You're the best.
Aw, you are.
That's great.
Thank you. She was one of our really star residents who really dug in, and she was serious when she said that. She really reached out to other people in the building. It took a long time to build trust with people. Here we are, a new company coming into the building, and what's sad is there seems to have been a high turnover of different people in the building trying to provide services for folks. And what we did, I think, was very unique and special. We were there consistently with our same staff. And so we were able to build trust and build those relationships with our clients. And I still get messages and phone calls almost weekly from folks that we've worked with over there. So that really makes my heart soar.
That's great. So let's switch gears for just a minute and go back and talk about Natasha. Like where was home originally? Are you from the New England area? And how did you end up in this field? Especially because it's fairly male dominated. And we're just wondering, how you got into it and how things evolved.
Yes, absolutely. It's a great question. So I'm originally from San Diego, California. I was born and raised there and lived there for 44 years. And my fiance and I are a little bit crazy, I'll have to tell you. We were very established in our careers. I was a healthcare administrator overseeing memory care communities in San Diego, and I absolutely loved my job. That's how I got into healthcare. I started out in healthcare sales and then was asked to do operations, which was a big jump for me. I'm not a nurse by trade. I never had any inkling to do anything nursing related, but I really loved it because I could see very quickly the impact that I could make in people's lives. And talk about a rewarding career when people thank you every day for what you do. I mean, my team members, family members, and my residents, it was just fantastic, and I loved it. So my fiance and I were both at kind of a pinnacle in our career, and we're fans of getting out of our comfort zone. We like to shake things up. We like to constantly challenge ourselves. So we decided to move to Rhode Island. We moved all the way across the coast and decided to start something new over there. So let me tell you, that was difficult. Moving to a place where we had no family, no friends, no professional contacts, and start a new life over there. And it was a blessing because I found Oak Street Health, and I was outreach director for Oak Street Health. So I was running 2 sales teams for a primary care doctor's office. And what a great position, because that allowed me to get to know not only the neighborhoods, but the healthcare kind of lay of the land in Rhode Island, but they are a national, Oak Street Health is actually a national company. But this is a niche I never knew about, helping folks on Medicare with value-based care, which is something I didn't know what value-based care was. And essentially what value-based care is providing additional services to folks that need it, but they are incentivized and measured on their success. So for instance, a regular doctor's office is kind of fee for service. You go in, you have your visit, they bill your insurance. There's no real incentive to keep you healthy and happy and out of the hospital. But with value-based care, there are penalties if you are not hitting your health metrics, and there are rewards if you are. So this opened up a whole new world for me. I said, wow, how come all healthcare isn't like this? I mean, our doctors, our nurses, our care teams, our social workers, transportation, we're so heavily invested in the care of our patients. That was fantastic. So that's kind of me in a nutshell, why I moved all the way across the United States and started a new life. And I will say, for anyone that's thinking about doing it, it was hard. There were days I thought, why on earth did we do this? Why didn't I just stay in my comfort zone with my cushy little life where I was happy? But I'm a firm believer that everything happens for a reason. And for me, that move made a huge impact in my life. I was able to start my own business.
That's wonderful. And it really puts you in a class by yourself as far as people thinking about, oh, someday I'd like to, or I wonder what it's like if, and hearing you really gives a dose of reality to what it is really like.
Well, thank you. And you know what I would always tell my sales team and anyone that ever came to me for mentoring, I had some wonderful interns that I worked with, and I would always tell them, based on my experience, when you feel fear, when you start to become fearful, that's when you should lean into that sense of fear. That's been the best learning tool for me, where people would normally find something that they're afraid of and kind of step away, fear, oh, that must be bad, I don't want to engage with that. No, that's a sign, that's a green light. You want to lean into that because it could take you somewhere on a wonderful journey.
So as we're on that journey that you've been on these past few years, the affordable housing residents themselves are among some of the most underserved and overlooked populations. Given that we know that, why do you think that's so?
Well, they're the most expensive population to serve, and it's very complicated to provide services for them. As I kind of mentioned, lack of transportation, lack of maybe understanding of the English language, maybe not knowing how to read, not having a telephone that works, not having access to the internet. And so I think the intent, there's a huge push to provide services for this community because they are so very expensive to provide healthcare for. And it is really what drives up a lot of our healthcare costs, but connecting with them and helping them follow through and helping them understand why it's important to take care of their health preventatively, right? Not waiting until they end up in the ER and everything's falling apart. It's very, as when I interviewed with Oak Street Health and I asked that question, they said, well, it's complicated and it's very expensive. And that is a true statement. So I think there is a large spotlight on serving this community, but it's very difficult to do. And frankly, I think that's why our niche worked so well, because when you're the boots on the ground, building relationships and being consistent and providing care in a compassionate way, that works.
Terrific. Now, when you look at what Trine Healthcare is actually providing, can you break down like what wellness and services can you bring to those communities?
Yes, absolutely. So we would have one-on-one exercise classes. We had group exercise classes. Some people are a little shy and they did not want to exercise in a group environment. I was so blessed. I worked with the University of Rhode Island interns in their kinesiology department. So I had students working with folks one-on-one and in a group setting. We did healthcare education classes. So we really dove in and talked about diabetes and how that can affect your life and how to manage it and why it's important. COPD, vaccines, right? We did a few vaccine clinics. We provided that service, but really help people understand why vaccinations are important for everyone and for the public health. We did a lot of social services work, so scheduling transportation to and from doctor's appointments, making doctor's appointments. I can't impress upon people how difficult it is to set up a doctor's appointment when you don't have time or patience or understanding to get through a phone tree in a doctor's office, or your doctor has changed their phone number or their address and you have no idea where they've gone or how to even find them. So a lot of social services work, connecting people with services like food, bill pay support, grocery delivery, PPE, and the education piece was very important. So those are the services. Oh, and also vital sign testing. We did vital sign testing. Surprisingly, that was very popular. I would have a line of people waiting every time I showed up for work, a line of people waiting to get their vitals tested. And how important that was, because we caught a lot of things early. Well, I shouldn't say a lot, but we caught a fair amount of potentially dangerous hazards early. And also we help people get their prescriptions refilled as well.
So when you say you were able to catch things early, what type of specifics might go with that?
So definitely for us, a lot of folks with high blood pressure and consistent high blood pressure. And one gentleman in particular didn't know how to get a hold of his doctor. She had changed her phone number. He did not have a computer. He did not have access to the internet. So we located her. We told her what his readings had been for the last 3 weeks and were able to schedule him an appointment and transportation. And thank goodness he was able to go and connect with her. I think if we wouldn't have been there, he would have just let it slide. And it took about 6 weeks to actually tweak his medications to get his blood pressure down into a reasonable range. Same thing with blood sugar levels. A lot of folks are not managing their diabetes properly. When your medication is either expensive or hard to get, a lot of our folks ration their insulin, or forgot to take it, or forgot to do their readings, or forgot to get their prescription refilled so that they could get their lancets and have their test strips. So we provided all of those services. So we could directly, if they were not able to give the readings to the doctor, we would manage that for them and give those readings to the doctor. And then also weight management. A lot of my folks had diabetes and were overweight. And so with the exercise classes and the healthcare education courses, we were able to help people stay committed to losing weight. I think we had a weight loss contest. I believe our winner lost 12 pounds and his A1C levels dropped, and his doctor was saying, whatever you're doing, it's working. Thank you.
You should have those folks on your team to spread the word about the value.
They were great. They really did. For all of our folks that joined the program and stayed consistent, they always really did talk to the other residents and try to get them involved. And they said, hey, this works. I mean, we feel so much better. You really need to come do this. I mean, it's a free service here at the apartment. So why not? It's not going to hurt you.
Exactly. And listening to Isis, even in your interview, she was an advocate and was saying, like, people think you're nosy, and yet when they learn what it's about, but they've got to hear it from her or from her colleagues or friends. And then it's real.
It's so true. When I was doing outreach prior to actually starting my own business there, that is the perception when a new person comes in the building. Who are they? What are they doing here? What do they want from us? I'm sure you all know that our seniors get scammed all the time. They get all these phone calls and mail inserts. And so hearing directly from the residents was a big proponent. And like I said, also the consistency, but that was a big value add for us.
Yeah, that's great. Now, look at it from the flip side. And if I were an executive in an affordable housing environment, I'm thinking from their perspective, what's the incentive? Why bother implement a wellness and healthcare program such as yours?
I think for a lot of reasons. Number one, I know from their perspective, it's dollars and cents. So I'll go with that first. So with the HUD programs that they offer, better financing, higher loan to value ratio, an increase in rent with some of their healthy services programs, that's a financial incentive for the business owners. But also, if you think about it, and this was something I really try to convey to people that I am reaching out to try to expand our services, is that when you have happier, healthier residents, you have less turnover and you have less crime and you have less potential vandalism, and you start to have a community, a real community where people are invested and they feel like this is a home rather than a transient place to live for a while.
Okay, well, you're convincing me. So from the standpoint now of working in this field, what are some stories? I know we met Isis and you've mentioned a couple. Are there a couple of stories that you could share just generically about individuals who flourished because of the wellness and healthcare or because of attending these programs?
Yes, absolutely. So one of my clients, I won't share his name, but he had a stroke, had a fall prior to us implementing our program, and he was walking with a walker. And he was also very isolated. When I started my business, it was August 2020. We were right in the depths of COVID. And so pretty much all of the residents were very isolated. So now you add on depression, lack of mobility. So when he came down and started working with us, he started doing our group exercise classes. And within about a month, his mobility had improved so much. He stopped using his walker, started using a cane. I always say, please, please, please still use your assistive device. It's very important. We don't want to have another fall. But a lot of things flourished for him. Now he had social connections. He had his friends, his neighbors, he had someone to talk to, and he felt good about himself because he had improved his mobility. We were still working on his weight a little bit. Nutrition was still an issue for him, but just to lose that, he said, I feel like an old man. I feel like an old man who can't walk with this walker, but he knew that he needed that walker because it was helping him stay safe. But after, like I said, about a month of exercise classes, he was able to downgrade to his cane. He started driving again. So that was a huge, huge impact. All of our folks, like I mentioned, that joined our weight loss program, they were all diabetic. They all reduced their A1C levels. They started feeling better and not as self-conscious because now they knew other people that were going through the same issues and had the same challenges. Sticking themselves and taking their insulin and sticking to a strict diet is very hard. So sometimes when you have other people to talk about that with, it makes it a little bit more manageable. And then I had so many interesting one-on-one conversations with people that felt marginalized in the building, unfortunately. And so just having someone to talk to and know that it's okay to share your feelings. I feel like the mental health component of what we did was so very important, especially, like I said, during those depths of COVID. So people would come and talk about their sexuality and talk about the loneliness that they are feeling. And then we could make referrals if they needed professional referrals. So just to do those interventions were so big. I know a lot of doctors' offices and insurance companies were doing wellness calls, which is fantastic. But a lot of times people wouldn't even pick up the phone. I don't know that phone number. I'm not going to answer that. So the good intent was there, but the actual sharing of feelings did not happen. So we were able to step in and really assist with that. And probably I'll give you the last one. One of my residents was very, very medically ill. She got COVID, so she could not go out of the house and get food or any medicines or anything like that. And so we did all that for her. She didn't know, she didn't have a credit card or a debit card. She couldn't do grocery shopping online. And, I begged her to stay in her home. Please don't come out and expose other people. So anything she needed, pharmacy, food, toiletries, we were able to bring it in for her.
That's excellent. Well, you just wish you could push a button and have this be everywhere because it's so needed. So if I'm one of those residents in one of your facilities, how can they be more advocates so that their message can get out to where it needs to be? Because it seems like, listening to you, it's like they've got the answers.
Yes, they really do. And a lot of the building owners will submit questionnaires or surveys to residents and ask them, what services would you like? What are you lacking? What do you need help with? But from the information that the building owners shared with me, hardly anyone fills out those surveys. There's just a big disconnect. So now I will say some people are very vocal. There's a small subset of people that were very vocal and will advocate for themselves. But so many people feel like it's big corporate person and little old me. And so they're not going to listen anyways. And what are they going to do? Why do they care? They only care about money. I mean, this is, what residents were actually saying. And so that's a tough one. I really feel that the companies that do it right have quality resident service coordinators on site. They build those relationships with their residents, and they really do listen to what the residents have to say. And then I think, just going back to my healthcare administrator days, you can't just listen, you have to do something. You have to do something, otherwise you lose the trust.
That's so true. Focus for a minute just now on Trine Healthcare.
Yes.
You are a woman-owned business, correct?
Yes.
What are the challenges of that? Especially being in healthcare, when you think of it from an administrative perspective, it tends to be male dominated. And so what's it like being an entrepreneur, breaking into this industry?
I will say it's definitely tough, but it was only, I'll say it was only tough in my younger career when I didn't have my confidence and I didn't have a lot of experience yet. I have been very, very lucky that I'm very curious. I ask a lot of questions and I have a long sales background. And so in sales, you just can't get fazed by rejection, right? You have to just keep pressing forward. And when you're passionate about something, you just continue to march forward. So I will say, yes, there's several times I've been intimidated. Several times I was shy to ask questions. But what I've learned over the years and what served me very well is being confident in the things that I have learned, and also asking questions and reaching out to mentors, whether they be male or female, because you can really learn so much information from other people. And that's something I didn't do in my earlier career. And I think a lot of folks that just, are starting out are afraid to do that. Read voraciously, listen to podcasts voraciously, ask questions, join networking groups. What I've found is that people are willing to help. They want to help, especially if they believe in your purpose. So I put together an advisory board with an entrepreneur, a few nurses, and I'm still trying to get someone from affordable housing on my advisory board. But it's fantastic because we meet once a month and we talk about what issues arise in healthcare, and having that group of people to support me and share ideas is just fantastic. And that's just something I didn't do earlier on in life. But if I'm met with a glass ceiling or someone tells me no, I just keep going. there's always another door to open.
It's such a great attitude, and it's so what one needs, especially now, given this environment of the last couple of years. What do you see as the future of Trine?
In my vision of Trine Healthcare, we will be operating in every affordable housing building across the United States. It's interesting because the landscape of healthcare is changing very quickly. It's changed with COVID. A lot of services are being moved toward a virtual environment. As a matter of fact, that's a project I'm working on right now, is to do virtual healthcare content, which I'm not exactly a fan of, I'll be honest. I think the personal connection is so important. But as any good business owner, you can't ignore what is happening. You can't ignore growth and progress. You have to embrace it. So whether it's virtual content that I can deliver in every building, or still in person, because I just think in person is so important. But we have to be prepared if there's another natural disaster or pandemic or anything like that. Here in Texas, we had the big freeze last year, and then so many people were isolated. They couldn't do anything. They didn't have services. So just pivoting and figuring out a way to still deliver healthcare, education, and services to people, even in that environment, is the challenge going forward. But that's the vision I have for the company in my head.
Do you see programming within Trine Healthcare as expanding and adding additional
Yes.
services? And if so, what might they be?
Yes, most certainly. So even when I was operating out of Rhode Island, I was trying to find a nurse practitioner to come on board so that we could actually see people in their homes. There's some communities that have it, or a version of that, and it's been very difficult to find nurses. They're in extreme high demand right now. But again, just that personal connection and that one-on-one care would be a huge asset to us. And I would love to add those services on board. And even as well, mental health, having a mental health practitioner, maybe just come to the site once a week. Telehealth, people are getting on board with it. They're learning how to do it. We need to improve how we deliver that with internet capability and devices that are actually user-friendly. But I still believe in the on-site process. So those are two people I would like to add to my team on site.
For people listening, given what you just said, either now or even listening to the recording in the future, what's the best way to learn about Trine Healthcare?
The best way is to go to our website, trinehealthcare.org. And if you have any questions for me directly, my phone number is on the website, and there's also an info email address. But that's the best way to learn about what we do and what services we have to offer.
Terrific. And you also said, just given how you plan to branch out and where you would like to see Trine Healthcare be operating in the future, a plan to get there. Like when you think in terms of national, what's it going to take? Because I look at the journey when you look at where you grew up on one side of the country, and then you literally cross the country and go to Rhode Island. And now here you are halfway across again. And so from California to Rhode Island and now in Texas, you are at least a traveler throughout this entire nation already. And if you wanted to spread wings from now and think nationally, what are some either advice you have to people who are thinking of doing this themselves, and or what are some of your plans as you look forward? Because it may be ways people can see that they could help you.
Yes, definitely. So I think about when someone is trying to expand their business, create a model that works. Number one, you have to show, quality data. You have to show that your service or maybe your product is working in it and people can use it, and then be able to replicate that in any market. So you have to know your market, right? You can't serve all the people all the time, but you have to know what your niche is very well. And so for me, I understand at the site what my care team looks like. I understand what services I need to implement, and I understand what programs I need to use to, either record data or prove my value when I'm talking to other investors or, other potential clients. And it's fairly easy, able to replicate, depending on staffing, which we all know is tough right now with everything that's going on. So, and then look at your markets. Where are the markets that have the highest need? So it's pretty easy for me to find where affordable housing buildings are. And then also you may want to even drill in and say, okay, who has services near those markets that I could really partner up with? So for me, implementing programs in places where universities are at and nursing schools are at, that's kind of my target growth plan. And then for anyone who's interested in doing that themselves, get a network. Get a network. Don't be afraid to ask questions. As I said, don't be afraid to have people play devil's advocate. I had a SCORE mentor. I had 2 SCORE mentors. I had my advisory board, and I always relayed ideas off of people, and I never took negative feedback personally. I used that to grow and to tweak my plan. And that's very, very, very important. And then lean into the fear. That's probably the best thing you can do.
Terrific advice. And one last item before we open this up. If you looked at this in terms of the peaks and the valleys, the highlights of doing this work, and then the challenges, look at both sides of that seesaw. Where are the highs for you? Where are those peaks? And then on the other side, where are those challenges? You might want to do the challenges or the valleys first, and then end with the peaks.
There you go. That's a good suggestion. So the challenges, the valleys are definitely the financial part of it, is trying to find clients that are willing to pay, that have the money to pay. Not one single potential prospect has told me that's a bad idea, we don't like that. Not one person has said that. Everyone loves the idea, and everyone has said they would love to have the services, but finding funding for the services are very difficult. I almost wish that I would have organized as a nonprofit and try to get grant money for the services. There's another company that does that, but even that company only has 2 or 3 locations. And I'm not a fan of, doing all the grant writing and research. That's just a whole nother layer that I don't want to really get into. So the financial part of securing new clients and the environment we're in financially because of COVID makes it very, very difficult. But certainly the peaks are what keep me going. So I'd say the biggest peak is every day showing up to work, seeing residents and seeing them line up to see us and to chat with us and to get help for the services they need, and seeing the success that they've had. When I started this business, I had no idea if it was going to work. It was really a shot in the dark, hoping that we would have some success. I didn't even know if any residents were going to show up. It was a big gamble, very big gamble. But to see that they were getting results, to see how much they enjoyed actually coming and doing the exercise classes and learning about their healthcare and opening up to someone who they didn't know before to talk about something so personal as their healthcare, that is the peak. That's why I keep going.
I have a question for Natasha, and that is, you're searching for funding, and there are many insurance companies, there are many organizations. Who would be an ideal funder? What kind of sponsor would make this possible for you to sprout out some pilots in Austin, Texas, and then be able to take these next door until it becomes national?
Yes, definitely the health insurance companies. So any health insurance companies specifically that offer a DSNP plan, which is a dual special needs plan, they tend to serve the Medicaid population. They would be fantastic advocates, and I've been trying to reach people and make those connections, because I think I would really be able to do the interventions that are needed to save them money.
Okay, so it's all about saving them money, so that becomes a prime selling point in your sales pitch.
Yes, definitely.
Okay, then I have another question. I'm on your website now, and your website is trinehealthcare.org.
Yes.
So are you a nonprofit or a
No, we're not. We're supposed to be a .com, but that extension was not available, so we had to go with org. So yes, it is very confusing.
But it would be if you had to switch.
If I had to switch, at least we have that portion covered. Yes.
Okay, great. Then I have another question.
Yeah.
When you moved from Providence to Austin, are you and your fiance both together in Austin?
Yes, we are. Yes.
And what does he do?
So he's a vice president of sales for a tech company.
Okay.
Yeah, so Austin, that's one of the reasons we relocated here. His CEO was very hot on Austin. They have a lot of clients here. So it just made perfect sense.
Okay. And so what you're basically doing with your focus, your purpose, is you're basically building and starting over. You're building a new network, you're building new relationships, you're building new opportunities, and you're in a build mode.
Yes, absolutely.
Okay.
A build, and I call the hunter mode as well.
Yep.
Hunting for new contracts. Yes.
Yes, okay. Very good. Joyce, do you have other questions for Natasha?
Well, the actual questions are ones that came in and said they weren't available now, but wanted to ask you. And some of it you've covered, but you might have some additional thoughts. Two in particular, one from really a midlife professional who's in an allied life planning profession already, and the other from a recent college graduate.
Okay.
And thinking that this is because saying looking at healthcare and how everything is so wide open and they're hiring as compared to hospitality and some of those others in agriculture that are going the other way.
Yes.
And he happens to have chosen a major in one of those downward. He said, I got to look at a whole, talk about pivot. I got to look at a 360 of just changing focus. And he said, would you find out from Natasha if you're a college graduate in a field that has nothing to do, but that
Yes.
almost doesn't sound different than when you started. So I'm saying advice to the recent college graduate. What would you say about pivoting and going into a whole different field where you have absolutely zero preparation, but you're highly motivated?
Yes, it's the best thing I ever did, honestly. So when I was working in hospitality, I did not feel like I was making an impact or a difference. I loved my job. It was a great job. I wouldn't say that it was a career that really made me wake up excited every day. And so it was scary. It's scary to start all over again, and you kind of lose your tenure wherever you're at. But I had a chance encounter with someone that introduced me to healthcare, which introduced me to assisted living. And I just got a really good feeling. And I think if this gentleman has a really good feeling in his soul about something, it's not too big and too scary. And I look at life like this. You can always continue to build, right? And healthcare is a great profession because yes, they're hiring like crazy. You will have longevity if that's what you desire. But I would instruct anyone who's thinking about a career pivot or a life change, make sure it really resonates with you. Make sure you really feel like, wow, this makes me excited to get up every day, because that's definitely the way I felt about helping people.
Okay, in terms of training, would you recommend, well, there's really a double question here that came from someone else. Training either at midlife or training a college graduate who's has that degree, but now saying, now what? Are there specific skills that you would recommend either of those age groups pick up? And then the second part of that is, what should they be reading? Are there journals, newsletters, individual people? Like what kind of, how can they better prepare themselves and prepare for this field if they're at home and they just want to get knowledgeable on their own?
Yes, so I would recommend, the first thing I would recommend is that they do some networking, join some healthcare networking groups. If they have the time in their schedule, they can also volunteer. So for instance, let's say someone is thinking about maybe becoming a respiratory therapist, but they're just not sure. They've read about it, maybe they've seen some videos on it. If they can shadow or they can volunteer for a little bit of time, that really gives someone a good perspective of what the actual job is like and what the actual environment is like. That's what I'm hearing a lot from people, is that I like the job, but I don't like the environment. And environment is important because that's where we spend a lot of our time, more than with our families. What should they be reading? There's so many great podcasts out there. There's so many great YouTube videos and blogs out there. So if they were interested in a particular field, I would look up podcasts that had people from that field. Their networking, as I mentioned, is really going to help. Reading, you can always read books on certain topics or tasks. I like to read a lot of personal development books. I love anything by Tim Ferriss. I'm a big fan of his. Jocko Willink for leadership, I really enjoy reading. I read a lot of sales books as well, because I always feel like even if you're not in the sales field, understanding how to talk to people and persuade people and getting out of your comfort zone and being able to talk to any type of person, right? You kind of mentioned being maybe, being in a male dominated world, once you can conquer that fear of talking to people, that is a tool that will serve you very, very well. So I like Ryan Serhant, his Big Money Energy and Sell It Like Serhant. And I think it's really important to listen to a lot of financial podcasts as well, because hopefully your business takes off and you're going to need to know how to spend that money to grow appropriately, to spend and to save and to finance. So I think that's really important as well.
That's great. Natasha, this has been a wonderful hour. And we will be, of course, we know that there have been some glitches here, and we will be airing this actually later so that people will have a chance to listen and interact. However, if they have questions that we haven't addressed in this time, I assume that that's open to them as well. They can just contact you through your website and say, I heard your video, or I watched your recording, and I'm interested in fill in the blank.
Yes.
So you're available ongoing?
I certainly am, and I would love to answer all of your viewers' questions. Anyone, I mean, it doesn't even have to be healthcare related, about business, about personal development, about finding your passion. I would love to be a resource for all of your viewers and listeners.
Terrific. Well, we thank you very much, Vicki. Do you have anything we want to add? We want to introduce what's going to happen next week, but anything for the good of the order to complete with Natasha. We just want to thank you because we know you're in the middle of your work day, and this came out as a surprise, but just thank you for being as gracious as you were to make this happen.